on to our Health Watch, where we talk about all of the topics trending in the medical world, big and small, common and uncommon. And I think we're going more of the uncommon route today. Happy to be joined once again by Dr. Syed Hussain from Trinity Health of New England.
Morning.
A pleasure, sir. Okay, this is what we want to start with. A new warning from the U.S. Surgeon General, Dr. Vivek Murthy. He said there's widespread loneliness and isolation levels in America. And he said it's as deadly as maybe smoking up to 15 cigarettes a day. Apparently, it's as common as 1 out of 2 adults sort of feeling these feelings of loneliness. Can you expound on that? What's going on?
Yeah, Tim, this is a growing problem. So we've discussed this topic over the last several weeks in bits and pieces, but this is a growing crisis here, exacerbated by 3 years of this pandemic, which increased people's sense of loneliness and isolation.
Yeah.
And half of all American adults, that's 1 in 2 U.S. adults, have experienced loneliness, which then increases the risk of other health problems, including heart disease, stroke, and even risk of premature death by over 30%.
That's amazing.
It's huge. And individuals who did report feeling lonely or isolated tend to be those that do not interact or engage much with houses of worship, community organizations, even their own family members.
Yeah.
So the Surgeon General's report actually lays out really well what we need to do as a society. And there's a to-do list basically for employers, for healthcare professionals, for individuals. Social media is a big component of what is probably driving some of this as well.
Yeah, you know, I'm curious to read that because in sociological circles for I think years they've been talking about the decline of the third place. What they mean is your first place is home, your second place is work, but then there was always this third place, whether it was a church, a mall, a corner stoop, where people would get together for a sense of community. And they feel like those have been declining for decades now. And that sort of comports a little bit with what you said coming from that study. So I'd like to know more about that. Before we go, though, a new study found that hair relaxers might have an effect on women's fertility. What's that all about?
Yeah, this is an NIH-funded study looking at over 13,000 women. It started in 2013. It's still open. Women who are seeking to become pregnant and use of hair straighteners, chemical hair straighteners. So these products may include some chemicals that may be linked to decreased levels of fertility. So it adds to a growing body of research that indicates some of these chemicals and beauty products need to be researched even further.
Yeah, I'm curious how they were able to find that. Was it just something that were they looking for that correlation, or did they just happen to find it in the data?
So yes, they were looking for this correlation as well, given what we already know about beauty products, but more research is definitely needed in this area.
Absolutely, and that's why we say correlation. That's why science is great. It's just a step in the process towards a potential conclusion. Doctor, thank you so much for taking the time to join us today. We will see you next week at this time.